Well, it's hard to see your child in pain, but for many parents, keeping up to date on vaccinations is considered by some in society a necessary obligation to keeping their kids healthy. And that means a lot of shots. On average, American children now receive 26 vaccinations by the age of 2. That is unless parents exercise their decision to opt out. Now, Oregon now leads the country in the number of parents who choose to exempt their kindergartners from school-required vaccinations. And for most of the U.S., parents do not have the right to make that decision for their children for religious or medical reasons. But last month, the Oregon State Court of Appeals ruled that the state would be better equipped to make the decisions other than the parents and 8 Marion County children. Now, the court ruled that the parents who had lost custody of their children a year prior due to unspecified reasons did not have the legal right to exempt their children from required immunizations for religious reasons. Now, vaccine refusers are seen by some as threatening public health, but just what rights do parents have who may be opposed to vaccines due to their unknown risk when it comes to making medical decisions for their children? And when should the state step in? Well, with me to discuss this in depth, I'm joined by Dr. Sujatha Reddy from Atlanta. Hello, Dr. Reddy.
Hello there.
So what is the line? Where's the line drawn for parents and their ability to exercise their discretion about what type of medical care is imposed on their child?
Well, I think, the parents obviously have the last say in virtually everything, but when we look at vaccines that are known to save lives, I think here it's pretty much a no-brainer that vaccines are helpful. And if you ever have met anyone or know someone in a third world country who saw someone die or get very ill from a preventable disease, they will tell you how important and lucky we are to be able to get vaccines universally in the U.S.
Well, that's certainly an excellent point. What does the law have to say, about parents who want to opt out? Is there anything on the books?
Well, in some states, there are some laws that allow parents to opt out, but you will see, we actually have seen in medicine trends of, children dying of things like whooping cough or pertussis in states where parents have opted out. And I can only imagine if you're the parent of that child, how bad that must feel if you've not vaccinated your child and they can contract whooping cough and die from it, how terrible that must feel. But there are some states when parents can do that. But what we're starting to see is when you don't vaccinate, you lack herd immunity, and so we're going to start seeing children, who even though they got vaccinated are going to be exposed to things and may get ill because these other children aren't vaccinated, and that's very concerning.
Do you think that parents just aren't informed on the benefits of vaccines, or are these parents who are refusing to immunize, do they have a legitimate fear that it can threaten their child's health?
Well, I have to think that anyone that doesn't vaccinate their child is thinking they're doing the best thing for their child. But I have to think that that's not based on fact. There was some concern about side effects of vaccines and things like autism, but all that has been really disproven over and over and over again. And, medically, there is no question that the benefit of vaccines, outweigh the small risks.
Okay. Talk to me about the public health concerns when it comes to parents who don't vaccinate.
Well, it's kind of like I was saying before, that whole concept of herd immunity. We've almost eradicated a lot of childhood diseases in the U.S. because we have such a high penetration or a high percent of people who get vaccinated. And if you start losing that, we're going to start seeing outbreaks like we've seen in California of preventable diseases. So not vaccinating can become a big public health problem. So it is a concern.
Do you think that diseases that have been eradicated, they may make their way back into mainstream if this trend picks up any more than it already has?
Without a doubt, there's some parts of the world where, terrorist groups are preventing vaccination because they feel it's a Western influence, and we're starting to see things like smallpox outbreaks. So absolutely, this could become a problem.
Okay, Dr. Reddy, talk to me about those parents who they have a fear that there is going to be an impact cognitively on their child, perhaps a link to autism through vaccination. What would you say to them, if they're coming to you with these concerns? What options do they have?
Parents do come to me with those concerns, and I think you have to have a good discussion with your healthcare provider, whom I hope they would trust. If you can't trust your physician, you need to get a new physician. But I think you have a good discussion with them, and you know, all of us in medicine are pretty much going to say the benefits outweigh the risk, and there really has been no proven link between vaccination and autism.
Okay. Well, can a doctor, Dr. Reddy, can a doctor refuse to treat a patient who opts out of vaccinating?
We can say we're not going to treat someone, or you're going to limit their visits, because if they're going to bring a disease to your office, you're going to be worried about your other patients. So if you have enough valid reason, you actually can say, you know, I think this is not going to work for me. I'll take care of you until you find another physician. And we call it dismissing the patient, but that is possible.
Okay. Well, Dr. Reddy, we have to leave it there. Thank you so much for speaking with me. That was Dr. Sujatha Reddy from Atlanta.
Thank you.